Today, the National Suicide Lifeline launched their new easy-to-remember phone number for people experiencing a mental health crisis. Dialing 988, just those 3 digits, could get help for someone who needs and fast. THV 11's Frederick Price shows us how that'll work here in Arkansas.
Easier access to help in the middle of a mental health crisis could make all the difference.
This is going to be a game changer for mental health.
Dr. Buster Lackey is the executive director of the National Alliance of Mental Illness in Arkansas.
1 in 5 people has some type of mental health issue.
Jacob Smith with the Arkansas Department of Health says the previous 10-digit suicide lifeline was simply too time-consuming for some people. That's why back in 2020, the FCC approved 988.
So this is just a little bit easier way of remembering the number.
But with just 3 call centers in Arkansas, there are some concerns with the potential increase in callers.
From May of 2021 through June of 2022, there were 14,000 callers.
Smith says they were only able to answer a little more than 10,000 of those calls.
We think that we'll see a slight uptick in numbers or of callers that call into our call center.
But even if they are overwhelmed, the department says they have additional staff trained to make calls. Dr. Howard Turney is a professor at UA Little Rock. He tells THV 11 this latest advancement shows that people are no longer putting mental health on the back burner.
It also raises awareness that this is a problem in our society that touches many more lives than maybe some realize.
And 988 will hopefully ease the challenge of talking with someone who could potentially help save a life.
For people to access that, string to hang on to until they can get the help they need is a great stride for our country.
In Little Rock, Frederick Price, THV 11 News.
The Biden administration has also invested over $400 million into strengthening and expanding the call center infrastructure. That includes funding directly to states. But states are also allowed to impose their own fees to cover those remaining costs.